Inflammation certainly plays a role in the genesis of the acute coronary syndrome. There is very little doubt about it. Inflammatory markers as such are not the pathogenic mechanism. So they are a marker of what is actually happening. They actually tell us about the mechanism that is in action, which is the inflammatory process, the atherogenic process. So the answer would be inflammation, yes, plays a major pathogenic role. Markers of inflammation are not markers of the pathogenic, are not part of the pathogenic process, but markers of the pathogenic process. Inflammation plays an important pathogenic role, and therefore there is a modest role for markers of inflammation in the clinical setting, particularly in subgroups of patients. Not quite sure that they play such an important role in the context of the acute coronary syndrome. Perhaps in other areas of ischemic heart disease they might. In relation to the other markers, markers of ventricular dysfunction, for example, like NT-proBNP, it has an important clinical role because it allows the assessment of the presence of heart failure, but also is able to guide treatment. So an important role for those markers. And certainly for markers of necrosis, a major clinical role, absolutely vital, which is the detection of cell damage and also the ability to provide prognostic information. We have been working together with many other groups around the world very hard in trying to establish the potential role of inflammatory biomarkers in clinical practice. Over the past 10 years, I think we have gathered enough information to convincingly state that inflammatory biomarkers are biomarkers of cardiovascular risk. What is still problematic for the clinician is to understand or to know what is the additional information that these biomarkers provide. And in that sense, I think they provide modest information in the context of chronic stable coronary artery disease, little information in terms of the acute coronary syndrome, where patients do have an increased risk anyway, and a doubtful role in the routine use for detection of patients at risk in the general population. Although this may be debatable because there are groups in America which are actually proposing inflammatory markers as important markers of risk in the general population. But I think that the evidence, particularly recent papers, are not supporting that 100%. I think there might be a niche, small subgroups in the general population that certainly might benefit from the use of these biomarkers, but by no means all the patients or all the sort of the population as a whole. The results of the SIESTA study have been confirmed by other studies more recently. And I think that the message essentially derived from these studies is that biomarkers of inflammation contribute modestly to characterization of risk in these patients. Perhaps if we combine these markers with other biomarkers, such as cardiac troponins, NT-proBNP, imaging biomarkers, then the whole sort of, using the whole spectrum of these biomarkers, we might be able in a position to find a useful role. But if we take just biomarkers of inflammation as an isolated group, then the studies have confirmed that the information they provide, the additional information they provide, is rather modest. The impact of our message is, in a way, not extremely optimistic, because clinicians will be reluctant to use these biomarkers in view of this, of the message of the paper. But I think this is good because it will allow us to continue the search for more useful markers of cardiovascular risk. I think that negative results or relatively negative results are very important in research, although they tend to be less sort of accepted in publications because of the negative connotations, I think they're quite important to actually rule out the use of certain things which may not be that important. I think these are very exciting times because imaging in cardiology is growing very, very fast and providing very important information. So I believe that we need to start looking into ways of combining the information that imaging provides with the information that biomarkers provide. And by assembling them together, I'm pretty sure we are going to provide the clinicians with very useful tools.